Okay, so the disease, that injury of the nipple, breast, there is two conditions are there. One present as a acute conditions and other as a chronic conditions. First thing, the hematoma, that is present acute conditions, and the other condition, that is fat necrosis, that present as a chronic conditions. So why it is very important to discuss these things, that especially this chronic fat necrosis, because it's very important, because the presentation of the chronic fat necrosis is just very much similar to that malignant carcinoma of the breast. I tell you why, means how it is look like similar. So due to any kind of that insult of the tissue, either direct insult or indirect insult, either the injury or that seat belt injury while driving, or some any kind of the insult to the tissue of the breast. So what happens, there is the due to this tissue insult, because that fat is there, so fat is it starts necrotizing. So this necrotizing fat in between has a hematoma. What the tissue is injured, there is a bleeding. So this the focal lesions are there. This focus is small focus may be there. So that focus in middle of the focus, there must be an hematoma due to that trauma and the bleeding. Later on, that the central part of the hematoma get liquefies, and there is a necrosis of the fat around that around that hematoma, that tissue, and it is surrounded by the inflammatory tissue. Understand? Means there is a central part which become liquefy, the fat that become liquefy, and it is surrounded by uh, inflammatory tissue of the breast. That later on, when the when there is the inflammation, when it reduces, they subside, the inflammatory state gets subsided, and the healing starts. In later condition, there is the development of the fibrous tissue, the development of the scar. So that's why that complete lesion looks like a hard tissue, just like a ball which is filled with the liquid, and surrounded by a hard layer of the fibers. Understand? Means that complete structure, uh, the circumferentially it's hardened with the development of the fibers, followed by this inflammations, and in the central part of that the liquid fat, and that fat later on, that tissue, the macrophages and filled with the inflammatory cells, and the debris of the cells, it is centrally liquid part and surrounded by fibrous structure. So in that condition, if it is get secondary infections, that time this fat necrosis get infected, and this is the development of the abscess. But usually it doesn't happen, because it is inside the body, and very and covered by a hard fibrous structure, so that the infection usually not reach to that part. So uh, with the with the time as the passes, the central part also become fibrosed and dense collagens, so leading to that complete hard mass, means complete structure, that is just look like, give the appearance of that carcinoma. uh, because of this dense adhesions, dense fibers and collagenous tissue, this has adherence, means this is this mass will be fixed, not mobile, and it has some puckering characters, means it's pucker the skin overlying the skin, it is adhered to the mass. Just similar to that, the feature is just similar to the carcinoma. That's why I am discussing with you this fat necrosis, because these conditions is look like very much similar to the carcinoma of the breast. So these that when you examine the patient, you file the mass which is painless, because in the period of time that inflammation gets subsided, and then that the pain will be resolved. Only the mass, the painless lump is there, which is fixed, not mobile. Puckering is there. In that condition, you have to even in the mammography, if you do the mammography, it looks like the same, like the mass of that malignant mass, carcinoma. It has no difference with that. Only when you do the biopsy, that can only give you final diagnosis that this is the fat necrosis, this mass is not cancerous, and the cells are well defined. So this is the chronic condition. Usually some get, some person get hurt, or some person get injured, some breast tissue get injured or insult, any kind of the insult, and over the period of time it develops the fat necrosis and leading to the fibrous mass. So this is the chronic condition. And the other condition is the hematoma, is the acute condition. So that some tissue of the breast is get injured anyhow by the any direct injury, or any direct, indirect injury means giving any that injection, subcutaneous injection over the breast skin, or any giving that implant, that may give that this kind of the injuries, that after the bleeding, there is the collection of the blood. So that also looks like heart, but it has this, as it is the acute condition, so it, you may easily diagnose, because patient must have any kind of the injury, history of the injury in that condition. So these are the two injuries of the breast tissue that we have to we must know, we must to identify, and we must to know how to differentiate it from the other conditions. So after that, we just discussed last lecture the diagnosis, how to diagnose, and then comes the disease of the nipple. So there is some congenital disease presentation, some supramammary nipples, that athelia or amasia, absent of us. Next come to that disease of the nipple. This include nipple retractions, cracked nipple, papilloma of the nipples, retraction of the retention cyst of the gland of Montgomery, eczema or Paget's disease. So first come to that, we already had detailed discussion in this kind of disease, but some important conditions we have to discuss again in the details. That is the nipple retractions. It's very important. You can see in the pictures, this is the normal, sorry, this is the normal nipples, means it is elevated, and elevated enough to so that the baby can hold the nipples and for the sucking. And this one is the flat. So this is the not a disease. The flat nipples may be the congenital features, and sometimes uh, have no significance. And this is the inverted nipples, where the nipple is get inverted. This condition may be the pathological. So retraction means that when this nipple is not over that above the skin, it get inverted, it gets inside. So this is the pathological conditions. Sometimes it may be the physiological also. In the early stage of the life, at the time of the puberty, there is the retraction, may be there in few patients, which uh, later on maybe revert itself also. But recent, it may be the unilateral or the bilateral. In 25 cases it may be the unilateral. So next, the two type of the retraction is more common. That is, one, this is the slit like retractions, and other, this is the circumferential retractions. So these two are very important, as this slit like retractions maybe the cause of duct ectasia or the chronic periductal mastitis, means there is the lenticephalic duct. Duct ectasia means ectasia means the dilations, when any duct is dilated, so that this type of the presentation is there. There is the nipple become slit like. Okay, complete goes inside, and due to the dilation of the nearby the duct, it covers the complete overlying skin, so it becomes just like the slit like. And these conditions present in the duct ectasia. Chronic periductal mastitis means the inflammation around the duct. So these are two conditions which present with the slit-like retractions. Next, the circumferential retraction means that complete. You can see in the picture that nipples is surrounded by, means swelling is all around the areola, and in between the nipple is just going down, and the everted, the nearby areola is everted, and the nipple gets inverted, and it's covered by that areolar tissue circumferentially. So this condition, with or without underlying any lump, may be well indication of any underlying carcinoma. Means if you find a patient of that circumferential retraction of the nipple with any palpable lump or without any palpable lump, may have possibilities, very much chances to develop any kind of that ductal or lobular carcinoma. But any patient having the slit-like fractions, that may be the possible cause of the ectasia, that is not malignant condition, or any chronic periductal mastitis, that is also non-malignant condition. That's why it's very important to the character of the retraction. It is slit-like or it is circumferential. That's very important. Now the what are the treatment for this? So first to go for the to exclude that malignancy. So for the non-malignant conditions, treatment is usually unnecessary, and the condition may be spontaneously resolved itself during the pregnancy or the lactation, when the you found the retraction of nipple in the puberty or the early stage conditions. And if the condition is not malignant, and the retraction is there, that for the that surgery must be performed for the only for the cosmetic purpose. So in that conditions, that surgery may be performed to give the normal nipples, and that patient must be advised to use that mechanical suction device, to use this evert nipple with or to use the which can promote that eversion of the this traction nipple. Means that conditions may be in the, if it is non-malignant, in that condition using of this mechanical device may somehow reverse the condition, and nipples may be retract that evert it outside itself. Otherwise the surgery may be required only for the cosmetic purpose, first to convince the patient that it is completely unnecessary. But in some cases, patient is suggested that that kind of surgery may be advised. Next important things is the discharge from the nipples. There are so many so many conditions which can have the discharge of the nipples. So basically there are the seven types of the discharges occurs in the in these multiple conditions. So that seven type of discharge: the discharge of the milk, discharge of the serous, discharge of the blood, discharge of the greenish material, discharge of the blackish material, discharge of the pus, and creamy discharge. So these seven types of the discharge can be occurs in the patients of that few particular conditions. Suppose that milk, usually it is physiological, the pregnant lady may have the milk discharge, or the condition after that pregnancy, after the lactation is over. In that condition, that condition called galactorrhea, in that condition this milk may be discharged from the nipples. And few drugs are there, chlorpromazine and metoclopramide, or the continuous use of the oral contraceptive pills, that may causes these conditions, the development of that milk in the non-lactating mothers. But so sometimes it has been seen in the young baby which is born after 2 3 days of born, that young baby may have the discharge from the nipples. That may be due to due to that baby getting that luteinizing hormone, that LH hormone from that mother from through the placenta. That's why it's happening. And these are the self-limiting condition, nothing to worry about this. And these conditions may be resolved itself. Next discharge, that is serous. This is also maybe the physiologically after the overuse of the oral contraceptive pills. Means if the patient having used oral contraceptive pills for the longer time use, then that patient may, as the complication of this oral contraceptive pills, patient may have some oral some serous discharge from the nipples. And other conditions, that is ductal papilloma and ductal carcinoma, these conditions may be present. Next, the condition where the patient has the blood discharge, that most likely due to the patient having the condition ductal papilloma or ductal carcinoma. So, and that greenish if the greenish solution is discharged, that is the condition called fibroadenosis. That is kind of that benign condition where the adeno that glands having that benign conditions, and which causes the secretion of these green color solutions. So this is the fibroadenosis conditions. And the black color solution, usually this is the any kind of the that when the blood is discharged, and if it is after the, when the blood is released from the vessels, and it remains for longer time and not coming to outside, so after the clotting it become black color. So this condition, the ductal papilloma and ductal carcinoma, which may causes the bleeding inside the tissue and inside the blood breast tissue, and along with the duct ectasia is remain inside. So one more condition may be there, duct ectasia there. So the bleeding is there and remain inside, and after that it comes out. So it is that secretion will be the black color. So the condition along with the duct papilloma, duct carcinoma, duct ectasia should be there in the condition of the black discharge. And next condition, if the pus is there, that is clear, it must be some infection conditions. Means the inflammatory conditions that causes that causes the discharge of the pus. If any pus cavity is inside and it is open to that to the duct, so through the duct the pus is coming out. So it must be mastitis conditions. And that next, when the condition of the mammary duct ectasia, mammary means that mammary gland, ectasia means there is a dilation, so that some milk is collected in that in the duct for the longer time, and after that few days if it is discharged, so that milk is converted into the creamy solutions, the creamy thick solution. So if the solution is it is a creamy, so that condition will be the duct ectasia, that is the benign condition, only the dilation of that duct. So these are the few discharges which can be present in these particular conditions. There are some diseases which has the which may have the discharge of the nipple. So that is the unilateral or the bilateral. So when the discharge from the single duct means only single pore is involved, only single duct is involved, and the blood stains secretions are coming from that duct, that opening. That condition may be the intraductal papilloma, intraductal carcinoma, or the duct ectasia. We already had discussed. And sometimes the discharge from the surface, not from the duct, means that may be the condition of the Paget's disease, that is the that malignant condition of the areolar tissue, that may be the some pus discharge is there, that is from the skin due to the psoriasis, due to eczema, or any rare type of the sancre. So that conditions may be the chronic ulcers over the lined skin. So this discharge occurs from the skins. And if any serious discharge is there, that condition may be from the single duct. That condition may be the fibrocystic, that is fibroadenoma, the greenish colors there, duct ectasia, and the carcinoma. And when the discharge occur from more than one duct and it is blood stain, that it most likely to the carcinoma, duct ectasia, or the fibrocystic disease. And if it is black or green color, that may be that duct ectasia. If it is purulent, means the infection. If it is serous, the fibrocystic disease, duct ectasia, carcinoma. And the milk is secreted in the lactation or the rare causes, some that pituitary tumor and hypothyroidism. These are two conditions which may involve this type of the secretions. So after that, these conditions, what are the treatment? So in all the conditions, if the patient is below 35 days, okay, then you have to exclude only one thing, means just take the proper history and rule out any underlying conditions. And the patient and reassurance is the enough, means no surgery or no medical advice, only the because most of the conditions below 35 are that only physiological or the malignant conditions, sorry, only the physiological, or that uh, any physiological that may be the self-limiting. So only reassurance is enough. No active management is required in that condition. But the patient is above 35 years, then first step should be do the mammography. And after the mammography, if you see any kind of the mass is there, then you must think that that condition may be the that any malignant condition, the ductal papilloma, or that and that ductal carcinoma, or the lobulated carcinoma. So the and if any only single duct is involved, that is duct ectasia is there, only single duct is affected, which is causing the discharge, the duct papilloma, or the duct ectasia, or the condition where the single duct is involved. That in that condition, one surgery called microdochectomy. Microdochectomy means just excision of that duct only, which is causing the problem. That surgery may be advised if it is not resolving by the reassurance or the way that conservative management. If and there is no underlying condition, no physiological condition, no drug history, and the patient having that particular conditions due to involvement of the single duct, then better to excise that duct. That condition, that procedure is called microdochectomy. So next in this slide we can see what are the step of the microdochectomy procedures. Here you can see first, first you have to identify the duct, which duct is involved in the secretions. So by the by the proper inspection of that nipples, you hold the nipples and press it, you can see from the discharge from that pores. You identify the pores from where the discharge is coming out. Then you just identify the pores and you just insert the probe, so that you can little dilate that duct. And then you insert the dye inside the, you can see in the second picture, you are inserting the dye inside this duct, this particular duct. Then you again take that nylon thread, or better you take that one probe, just a probe, hard probe, and you insert that probe inside that duct. After inserting the duct up to 4 to 5 centimeter, because most of the condition which are present in the duct are up to 4 to 5 centimeter only, not more than deep this 4 to 5 centimeter. Just insert your probe up to 4 5 centimeter and then fix your probe with that nipple around skin around the nipples with the simple suture, that simple skin that silk sutures. For very fine sutures, you have to fix the probe with the skins. Then you give the circumference incision around the areola, and then you open this open the after giving incision, you open that area. And because that duct is having that probe, it is well identified by the by the palpation. So by the palpation, you just separate all that other tissue from this duct, and try not to injure all that ducts. Just to separate these ducts from the other breast tissue, and start from deep and towards the from deep towards the nipple. You excise complete duct from 4 to 5 centimeters, and secure all the kind of the hemostasis there. And close this, then first close the breast tissue inside, then after that over the skin, you have to close this wound with the fine sutures of that silk, or any other that proline, any non-absorbable sutures, which can you remove after 7 to 8 days, and give the pressure bandage to avoid any kind of the hematoma or the bleeding. So this is the simple structure procedures. First, to identify the duct, the opening of the duct, then you dilate it, then you insert that dye, so that you can you can easily identify that the duct. Then you insert the probe in the duct, and you fix the probe from that skin around the nipple, and then you start separating this duct from the other breast tissue. Try not to uh, injury other duct which may comes in the way. And then you separate these ducts from the other breast tissue. And the blunt dissection is better, means that dissection by the fingers or the artery forceps. Okay, better not to use that scissors. You can use that cautery. Then you separate this complete ducts from the breast tissue, achieve hemostasis, means stop any kind of the bleeding, and then close the wound and give the pressure bandage. Okay, so this is all from that microdochectomy procedure. You can do easily in that local anesthesia or that general anesthesia, or depends on the availability or the choice of the surgeon and the patients. So this condition is easily treatable if you find that any single duct is having any problem, and give it a problem to the patients. And there are next few conditions in that the breast disease, that is physiological condition called the fibroadenosis, also called as the fibrocystic disease of the breast. So the patient of these conditions usually present with the mastalgia, means the pain in the breast tissue, and may have some nodules or lobules in the breast tissue, may have some lump. The patient may have some uh, uh, complain of some lump. So on examination, you may find some nodular structures, which may be the hypertrophied or that enlarge these lactiferous glands and lobules, along with some pain and tenderness. So and all these conditions occurs at the time of periods, at the time of menstrual cycle. So this condition is, and when the menstruation cycle is over, and then menstruation period has gone, then later on with the time, the condition may resolve itself, the pain resolve itself, and the mass reduces itself, the lump reduces size in itself, and it happen again in the next cycle. So this is the cyclic presentation of this condition. If you found any condition, any patient, so that is the physiological conditions which may happen in some moments while the menstrual cycle, due to that some hormonal changes. So just assurance is enough, no medical treatment or any hormonal therapy. Sometime this hormonal therapy may be required, otherwise no surgical treatment or any other management is required for this condition. This condition are mostly self-limiting and limit itself. Only you have to do, just you have to do that if the patient is above 35 years age, then no, do not forget to advise the mammography and rule out the any kind of the underlying mass, hard mass. If the lump is very hard, then you have to suspect that other condition, the malignancy. Otherwise the condition is self limiting, and sometimes the hormonal therapies are required. Otherwise mostly the condition is self limiting, nothing to do in these conditions. So next disease, next disease is the breast abscess, that is the mastitis, the inflammatory condition which we discuss in the next lecture.